So digoxin is a cardiac glycoside that will work by inhibiting the sodium-potassium ATPase pump. This will lead to increased levels of sodium in the cells, and that will affect calcium extrusion by blocking the sodium calcium exchanger, so that we are not having calcium leaving the cells. Now, what this will lead to is increased cardiac contractility. And since there will be abrogation or no neurohumoral activation, there will be reduction in the sympathetic tone, reduction in heart rate, and reduction in peripheral vascular resistance. At the renal level, there will be increased renal perfusion because there is increased cardiac contractility, which forces more blood out of the heart and into the circulation. So when it gets to the kidney, there will be diuresis, which will obviously reduce preload. Now, digoxin will also shorten the action potential. And this is important because by accelerating inactivation of the L-type calcium channels, there will be an increased risk of re-entry arrhythmias. This is also coupled with acetylcholine mediated shortening of the action potentials. So the actions, there will be positive inotropy, and what this will lead to is more complete emptying of the ventricles, increase in cardiac output, reduction in end diastolic volume. There will be reduction in heart rate and reduction in conduction. First off, because there will be reduction in heart rate because of abrogation of the neurohumoral activation. And the reduction in conduction is one of the principles used in treatment of arrhythmias, specifically, I think, atrial fibrillation. So the fact that there is increase in PR interval due to slow AV conduction, the inotropic effect is gradual and takes hours to develop, since calcium loading is gradual. I think something you need to understand is digoxin is a cumulative drug. So the time when we get to steady state and when we get to peak effect of the drug, there will be, it will take time because it's something that you're just loading slowly. And another thing that's important is there will be a narrow therapeutic index, since therapeutic and toxic effects will depend on myocardial loading. That's why this drug is usually given at very low doses, and once you exceed the dose, that's when you get to toxicity. Now at the CNS, high doses will lead to chemoreceptor trigger zone activation with manifestations such as nausea and vomiting. Others will include confusion, disorientation, etc. On the vascular smooth muscle cells, high doses of digoxin will increase calcium concentration, which will lead to vasoconstriction. However, in heart failure patients, vasodilatation will presume or will be higher, or will reduce the vasoconstriction mediated by this effect. I will explain this more in a separate video.